Welcome to this week's Health Commentary. I'm Mike McGee. This week, we're going to speak about public health as a nation builder. As Stanford professor of law, Lawrence Friedman wrote in the History of American Law, 169 years went by between Jamestown and the Declaration of Independence. The same length of time separates 1776 and the end of World War II. Time flies, as they said, but during those very early years that preceded the formal declaration and the formation of the United States as a nation, our various then British colonies fluidly and independent of each other did their very best to survive and then to organize into shared communities with codified laws and regulations. For legal scholars, law and lawyers are often viewed as rational instruments and necessary evils. But for social historians, they are, as experts say, a study of social development unfolding over time. They're impacted by emotions and politics and real-time economics. At the core of the struggle, however, is always a clash between the rights of the individual and those of the collective community. This clash of values has been playing out in full view over the past 3 years of the COVID pandemic. It's also why public health veteran and Washington Post columnist Dr. Leana Wen has come to the conclusion that, quotes, public health needs a reset. In her recent column, she asked, whose rights are paramount, the individual who must give up freedoms or those around them who want to lower infection risk? The battle between individual liberty and communal good is ancient, of course, and current at the same time, and still, it's a source of conflict wherever and whenever humans attempt some version of nation building. In our current case, as Dr. Wen described, some viewed mask and vaccine mandates as a direct encroachment on bodily autonomy. Others preferred them because they help people feel safer as they resume daily routines. Part of the reset that Dr. Wen is suggesting for our American society involves public health resisting the instinct to oversimplify and rather lean into the complexity by addressing decision makers at the interface of science and values. This redirects fear and wasted energy to the community's unmet needs. Common ground initiatives like preventive steps, such as better viral monitoring of wastewater on the one hand, and addressing the unintended consequences of our COVID response initiatives, like the massive drop in routine childhood immunizations for diseases. It's useful to recall that we humans have come a long way. From the beginning on the shores of Virginia in 1607, these early wild settlements were essentially lawless, that is, without laws. They also were wildly different in their dates of entry and their range of issues. I mean, consider the fact that more than 100 years separated the beginnings of the Massachusetts Bay Colony and the colony of Georgia. And as historian Lawrence Friedman noted, the legal needs of a small settlement run by clergymen clinging precariously to the coast of an unknown continent were fundamentally different than the needs of a bustling commercial state. In these modern times, we still resist acknowledging our own history of enslavement and mass displacement and destruction of millions of individuals and their cultures. And yet, here we are together, doing our best to push back against Trumpism that would halt our human progress. In many ways, the struggle to act in a civil and wise manner that mines common values and finds a balance between individual freedom and wise collective rules and regulation remains our hill to climb. Public health policy, debating it and formulating it, can help us get there. This is because it exists at the intersection of law and medicine. We should take advantage of this opportunity and make the most of it. Till next week, I'm Mike McGee.